Hello everybody. Welcome to number 1 Doctor channel. Today video is about Urologic Emergencies, which is part of our playlist called Short Medical Notes, in which we will have short videos about important topic in medicine. But please do not forget to like and share our videos and subscribe to our YouTube channel number 1 Doctor. And join our social media accounts in the links below each video. Our aim is to share the correct medical knowledge for all for free. Share and be shared. Today we will talk about urologic emergencies. Testicular torsion is seen in young adolescents. They have very severe testicular pain of sudden onset, but no fever, pyuria, or history of recent mumps. The testis is swollen, exquisitely tender, high-riding, and with a horizontal eye. The cord is not tender. This is one of the few urologic emergencies, and time wasted doing any tests is tantamount to malpractice. Immediate surgical intervention is indicated. After the testis is untwisted, an orchiopexy is done. Many urologists also fix the other side. Acute epididymitis is the condition with which testicular torsion could be confused. It happens in young men old enough to be sexually active, and it also starts with severe testicular pain of sudden onset. There is fever and pyuria, and the testis, although swollen and very tender, is in the normal position. The cord is also very tender. Lifting the scrotum helps. Acute epididymitis is treated with antibiotics, but the possibility of missing a diagnosis of testicular torsion is so dreadful that sonogram is done to rule it out. The combination of obstruction and infection of the urinary tract is the other condition besides testicular torsion that is a dire emergency. Any situation in which these two conditions coexist can lead to destruction of the kidney in a few hours, and potentially to death from sepsis. A typical scenario is a patient who is being allowed to pass a ureteral stone spontaneously and who suddenly develops chills, fever spike 104 or 105 F, and flank pain. In addition to 4 antibiotics, immediate decompression of the urinary tract above the obstruction is required. This is accomplished by the quickest and simplest means in this example, ureteral stent or percutaneous nephrostomy, deferring more elaborate instrumentations for a later, safer date. An erection lasting more than 4 hours after the use of erectile dysfunction drugs is also a dire emergency. The TV ads say so, but they gloss over the treatment. It may be necessary to stick needles into that erect penis, to draw out blood. Marketing strategy suggests it's best not to mention that. Urinary tract infection cystitis is very common in women of reproductive age, and it requires no elaborate workup. They have frequency, painful urination, with small volumes of cloudy and malodorous urine. Empiric antimicrobial therapy is used. More serious infections, like pyelonephritis, or any urinary tract infection in children or young men, requires urinary cultures and some kind of a urologic workup to rule out concomitant obstruction as the reason for the serious infection. Urologic workup uses 3 tests: sonogram, CT scan, and/or cystoscopy. The first is indicated for dilation and obstruction, the second is ideal for renal tumors, and the third is the only way to detect early bladder cancers. The old intravenous pyelogram IVP has almost disappeared, along with the nephrotoxicity and allergic reactions that made it risky. Pyelonephritis produces chills, high fever, nausea and vomiting, and flank pain. Hospitalization, 4 antibiotics guided by cultures, and urologic workup CT or sonogram are required. Acute bacterial prostatitis is seen in older men who have chills, fever, dysuria, urinary frequency, diffuse low back pain, and an exquisitely tender prostate on rectal exam. 4 antibiotics are indicated, and care should be taken not to repeat any more rectal exams. Continued prostatic massage could lead to septic shock. Thanks for watching our video and hope to see you again in next videos. Do not forget to see other videos in our channel. With my best wishes. Dr. Atef Ahmed.